In today's video, I'm going to be discussing the medication Adderall, and you're going to learn everything that you need to know about Adderall, so stay tuned. So what is Adderall? So Adderall is a combination of amphetamine and dextroamphetamine salts. Adderall is a dopamine and norepinephrine reuptake inhibitor, as well as a dopamine and norepinephrine releaser in the brain. This creates a central nervous system stimulation response, and therefore it's categorized as a central nervous system or CNS stimulant. Now, when you increase dopamine and norepinephrine in the dorsolateral prefrontal cortex, this improves attention, concentration, executive function, and wakefulness. When you increase those transmitters in the basal ganglia, this can help with hyperactivity. Now, when you increase these neurotransmitters in the medial prefrontal cortex and hypothalamus, this may improve depression, fatigue, and sleepiness. And Adderall comes in immediate release formulations and extended release formulations. And so what is Adderall used for? Well, Adderall was originally approved in 1996. And then the extended release formulation was approved in 2001. And the immediate release is approved for ADHD or attention deficit hyperactivity disorder in ages 3 and older, and the extended release is approved for ADHD in ages 6 and older. It is also approved for narcolepsy in ages 6 and older. Off-label uses of Adderall have been treatment-resistant depression as well as weight loss, though there is an FDA warning for using stimulants for weight loss as there is a high risk for cardiovascular events, and so therefore it's really not supposed to be used for weight loss. And so this off-label use has to be discussed with the patient and weigh out the risk versus those benefits. So how long does Adderall take to work? Well, if you're taking that immediate release tablet, you're gonna notice effects within 30 minutes, and these effects will last anywhere from 4 to 6 hours. If you're taking the extended release, this you're gonna notice within 1 to maybe 2 hours, and those effects will last typically from 8 to 10 hours. However, it's important to note that it may take several weeks to obtain those maximum benefits. So if you're taking it for the first time and you're not really noticing a robust effect, just know that over time those effects can become cumulative and you'll get your max benefit within a couple of weeks, usually 2 to 4 weeks. Also important to note that if you take Adderall with food, you're going to delay the peak action from 2 to 3 hours. So it's best to take it on an empty stomach, and we'll also talk about some other food interactions when we get to that section in a little bit. Now, is Adderall addicting? Yes, Adderall is addicting. It's considered a controlled substance and has been a drug of abuse for many people. So because of this potential for drug abuse, there's a lot of scrutiny with providers on how they prescribe it. There's also the issue of tolerance and dependence. When it comes to tolerance and dependence, it's also advised for many patients to take holidays from their stimulants, meaning taking a break on a weekend, maybe 1 or 2 weekends a month. If you're taking it during, for school, then on your summer break, etc. That way you don't develop that tolerance and dependence as an issue. Now, withdrawal symptoms can be very severe when coming off of Adderall, and these withdrawal symptoms will actually look like having severe agitation, anxiety, severe fatigue, and even depression. So it's important that if you're ready to come off of Adderall, that you do so slowly. And so what are those side effects? So the common side effects that we see with Adderall are the following: loss of appetite, weight loss, nausea, vomiting, abdominal pain, insomnia, emotional lability, or where your emotions are like a roller coaster, agitation, anxiety, nervousness, headaches, dizziness, tachycardia, fever, asthenia, which is muscle weakness, and even urinary tract infections were reported. And a less common side effect that should be noted is hypertension, which is high blood pressure. And therefore, it's very important that you monitor your blood pressure and even your heart rate while taking Adderall, because increase in heart rate and blood pressure can be significant for some patients. And therefore, it's important to use caution if you are taking blood pressure medication or you're known to have high blood pressure. Make sure you run this by your doctor and your cardiologist. So now let's move on to those warnings and precautions of Adderall. So first you want to note that because of the vasoconstriction of amphetamines, that this is not advised to be taken in pregnancy because you can decrease the circulation of blood to your placenta, which will affect your fetus. And so this can lead to premature birth and other risk factors related to pregnancy and pregnancy complications. You also want to be aware that Adderall can cause serious cardiovascular events. And sudden death has been reported with pediatric and adolescent patients and even adults who have known cardiac abnormalities. And how do you know you have a cardiac abnormality? Well, you have to have an EKG and a cardiac workup by a cardiologist. And so therefore it's very important that before starting a stimulant that you get an EKG and also an evaluation by your cardiologist or even your pediatrician if you're a child, because of this risk for sudden death. And other serious heart problems such as sudden death, stroke, and even heart attacks or myocardial infarction have also been reported in the adult population. And so stimulant drugs like Adderall should not be used in patients with a known cardiac abnormality, cardiomyopathy, a serious heart rhythm abnormality or irregular heart rate, coronary artery disease, or other serious heart problems. It is also important to note that alcohol will actually increase those cardiovascular risks. And so therefore you should not be drinking alcohol and taking Adderall. Another thing to be aware of is that psychiatric adverse events can occur with Adderall and other stimulants, because stimulants can actually cause emerging psychosis or even manic symptoms in patients without even a history of, say, bipolar mania or psychosis. So therefore it's important to be evaluated for this before starting a stimulant. And you would be a higher risk if you have a family history of, say, bipolar or psychosis. And also if you have bipolar or psychosis, it's not advised to use a stimulant, at least at first. You're going to want to make sure that your bipolar or schizophrenia or psychosis is under control, well managed, very stabilized for quite some time before you consider adding in a stimulant if you have the comorbid diagnosis of ADHD. But oftentimes providers will stay away from stimulants just to avoid the risk of going into a manic or psychotic episode, and therefore non-stimulants are more commonly used in those cases. You also want to monitor for aggressive behaviors for those patients who are more susceptible to mental illness, because aggressive behavior has also been shown to be a psychiatric problem that can arise with the use of stimulants. It's also important to monitor height and weight, especially in the pediatric population, because suppression of growth can be a factor. So it's also important to note that Adderall lowers the seizure threshold. And so if you have seizures on Adderall or other stimulants, it's advised not to take a stimulant such as Adderall for ADHD, and you would have to use a non-stimulant option. Another thing to consider is peripheral vasculopathy or Raynaud's phenomenon. As I mentioned earlier, Adderall can constrict blood flow, and this is especially important for those with Raynaud's or this peripheral vasculopathy because you're going to have poor circulation to your extremities, and if you're constricting blood flow even a little bit, it can make that problem worse, which can be very painful. So if you have any of those conditions, it's going to be important to talk to your provider about this and have it monitored very closely. And if you unfortunately have increased cutoff of your blood circulation, then you're probably not going to be able to tolerate the stimulants. It's also important to note to get regular eye exams because visual disturbances have been reported. Tics may also be problematic because it can exacerbate tics in some patients. So you want to make sure to be evaluated for tics or Tourette syndrome prior to Adderall or stimulant use. Serotonin syndrome can also be a factor, and this has been noted as an increased risk when Adderall or even other stimulants are combined with antidepressants or medications that act on the serotonin transport system. So monitor for serotonin syndrome if you're taking Adderall with an antidepressant, and this has also been noted in patients who overdose on their medications such as Adderall and their antidepressants, etc. And of course, the serotonin syndrome is more severe. At any rate, if you have serotonin syndrome because of Adderall use, you're going to have to discontinue the Adderall and get supportive treatments for your serotonin syndrome. And I made a video on serotonin syndrome. If you missed it, you can check it out here. Now that leads us to drug interactions. So Adderall is metabolized partly by the CYP2D6 liver enzyme pathway, as well as partly excreted in the urine via the kidneys. So if you have kidney failure, you're going to need to make dose adjustments, as well as patients with liver failure will also have to make dosing adjustments. And so when it comes to drug interactions, you mainly want to be aware of those inhibitors of that CYP2D6. And here's a list of some of them, but always make sure to do your drug interaction checks with all of your medications. And I'll make sure to put the link to the drug interaction checker down in the description. You also want to avoid acidifying agents or foods and substances that are going to decrease your pH and cause acidity in your gastric system, because acidifying agents such as citric acid, fruit juices, lemonade, orange juice, etc. can actually reduce the levels of amphetamines, making Adderall less effective and not work. So it's best to take Adderall on an empty stomach. The opposite is true with alkalizing agents such as baking soda and things of that nature. Alkalizing agents will increase the amphetamine levels in your blood, but this could have harmful effects because it's going to increase your risk of side effects, in particular those cardiovascular risks. You also want to note that the MAOI antidepressants are contraindicated due to a very high risk of hypertensive crisis and of course the risk of serotonin syndrome. So if you're going to start a stimulant and you're on an MAOI, it's important to stop that MAOI inhibitor at least 14 days before starting Adderall or any stimulant. And these specific medications here have been known to decrease the effectiveness of Adderall and other amphetamines. And it's important to note that Adderall can actually potentiate medications such as tricyclic antidepressants, NDRIs such as bupropion, and even meperidine, meaning that Adderall can actually stimulate those effectiveness, which sometimes can be used to the advantage of the provider and the patient to treat symptoms, but must be monitored closely because now you're increasing those risks of side effects like cardiovascular events, seizures, high blood pressure, high heart rate, etc. It's also important to note when it comes to drug interactions that antipsychotics can actually reduce the effectiveness of amphetamines like Adderall and even other stimulants. So it's important to keep that in mind as well. And so for my final thoughts on Adderall, it's important to note that stimulants are considered the first-line treatment for ADHD, but not everyone can tolerate stimulants. I just went over quite a number of side effects and warnings and precautions and risk factors, and maybe you may have one of those, right? And so not everyone can tolerate stimulants. So it's important to note that there are non-stimulant options out there to treat your ADHD, and also important to utilize skills before pills, as I always mention in my videos, and talk to a therapist about things that you can do to help better manage your time, prioritize your tasks, and be less distracted to overcome a lot of those symptoms of ADHD. It's also important with all medications to weigh those risks versus the benefits. So, have you taken Adderall or are you taking Adderall? Let us know in the comment section below what your experience has been, because we learn from sharing each other's experiences. And as always, I thank you for watching. I wish you well on your mental health care journey and look forward to seeing you all next week.